talking with Michael Botticelli, Director of the White House Office of National Drug Control Policy. So, Mr. Botticelli, tell us about the trend line for opiate overdose deaths.
So since about 2000, we've seen the dramatic increase in opioid-related overdose deaths, both prescription drugs and heroin. And while over the past couple of years we've seen a leveling off of prescription drug-related overdose deaths, we've seen a dramatic increase, about a 300% increase in heroin-involved overdose deaths. You know, we know that many people who are dying of a heroin overdose started by misusing prescription opioids. And so about 80% of people who are newer users to heroin started by misusing prescription pain medication. But we can really track this, the genesis of these overdoses to the overprescribing of prescription pain medication since the 2000 in terms of the number of overdoses that we've seen.
Mm-hmm. Well, how do you think that the CDC new prescriber guidelines, how do you think they'll make a difference?
I think they'll make a huge difference in terms of providing clear, kind of scientifically based evidence to the field on appropriate pain prescribing. You know, this has been all about balance. We want to make sure that people in pain are getting adequate access to pain therapies, but we also know that we are overprescribing prescription pain medication. And I think the CDC guidelines are kind of prudent, reasonable guidelines for prescribers on when to start, when to stop, how much to give people, how to continue to monitor people. So I think it's the first time that we've really had kind of a single comprehensive guideline for prescribers around opioids.
Mm-hmm. And you compared the opioid crisis with AIDS. Can you say that again?
Sure. So, you know, one of the things that I was taking a look at was the magnitude of the mortality with the AIDS epidemic before antiretroviral therapy came on. And, you know, when you look at the the mortality rate, you know, the mortality rate for the opioid epidemic is about what it was at the height of the AIDS epidemic, you know. So clearly, you know, we know that this is a significant public health crisis that we have here that really requires an equally robust response.
And with all of the opioids already on the market, should the FDA pause or slow consideration of any new painkillers?
I think the FDA has clearly signaled that it wants to really take a look at how it and what criteria it uses to approve opioid therapy. You know, again, I think this has been about balance, making sure that people get access to those pain medications. And, you know, they have, and the new commissioner has, I think, charged the FDA with really re-looking at its approval process around new opioid therapy, which I think is important. But I also think, you know, we have to realize that this still is about prescribing behavior, that we, you know, will always have opioid therapy. And, you know, there are some people who really need it. But it really comes down to, I think, better and more judicious prescribing than it is about how many opioids we have on the market.
Mm-hmm. And then one quick segue to marijuana. You used an analogy with tobacco. What lessons from tobacco could be applied to marijuana?
So, you know, one of the things that I think where we had to really work in terms of public health strategies was looking at how tobacco was marketed, how it was advertised, the availability and the sale, particularly underage sales, were particularly important for the work that we were doing. And again, I think we all have kind of reason to pause and to be concerned in terms of the commercialization of marijuana for personal use. And I know I am not alone in terms of public health folks who see a lot of similarities between the building marijuana business industry and the historic practices of the tobacco industry.
Great, thank you very much.
Great, thanks, Andy. Appreciate it.